The broadcast is now starting. All attendees are in listen-only mode.
Hello, and thank you for participating in today's ACSM Career Spotlight webinar on careers in physical therapy. I'm Heather Turner here at the ACSM National Center, and we're excited that you're able to join us for the third event in the new Career Spotlight webinar series. In order to keep background noise at a minimum, we will mute all phone lines during the initial presentation portion of the event. However, we want to leave plenty of time for your questions and interaction at the end of the event. So there are two ways to ask questions. If you look at your toolbar, you'll see the ability to raise your hand using the little hand icon on the left side of the toolbar. And if you select this icon anytime during the presentation, I'll be able to unmute your audio line so that you can ask a question either via the phone, or if you have a USB headset that you're using, you can ask the questions that way as well. Or if you don't feel comfortable asking over the phone, you can type in your question in the question portion of your toolbar, and I will read the question to the group for Dr. Miller to answer. This event will offer one ACSM continuing education credit, and following the session, the individual who registered for the event will receive an email with the CEC information as well as a link to a brief survey. We ask that you just take a few moments to complete the survey because every survey is reviewed and used to plan future offerings. Now let me introduce today's speaker. Dr. Lynn Miller is a professor of physical therapy at Andrews University. Prior to joining the program in 1990, she was an assistant professor of PT in Texas. Dr. Miller received her Bachelor of Science at the University of Utah, and she received her Master's of Science and her PhD at Arizona State University with an emphasis on exercise physiology. And she completed her MSPT at Andrews University in 1992. In 2003, she authored a book, Action Plan for Arthritis, which was endorsed by ACSM, and she has authored several book chapters since that time. Dr. Miller has been active with ACSM, having served in many capacities for the Midwest ACSM Regional Chapter, including President. She also served on the National ACSM Communications and Public Relations Committee for more than 10 years, and she participated in the Michigan chapter of the American Physical Therapy Association on the Research Committee and also on its Board of Directors. ACSM greatly appreciates Dr. Miller's willingness to share her knowledge. Dr. Miller?
Thank you very much. I'm glad to be here, and I hope that I can give you some basics. What I thought that I would do in this talk is I'm going to talk about three things. First of all, looking at preparing for physical therapy school, those of you that are in undergrad right now, different types of PT programs and the prerequisites, things you need to think about, the actual process of getting into PT school, and then I'm going to talk about the career options once you're in physical therapy, because I think talking about just careers in physical therapy is skipping some of the stuff that many of you are working on. So preparing for physical therapy school, I think the first thing that you want to do is sort of check the prerequisites that the schools have that you're considering. Most schools' GPA is the most consistent prerequisite in that it has been shown actually in research that it is the #1 predictor of your performance in physical therapy school. So the majority of schools will require that you have a 3.0 minimum GPA. Some may drop a little bit lower than that if you've got other attributes that they think are very important. The other thing is to look what activities you're doing, observation hours, volunteer hours. Again, most schools look for a well-rounded individual. And one of the things I would say, though, with those volunteer hours is, at least for us, if we're looking, we look for, are you consistently participating? I'd rather that you're doing one or two things on a regular basis than a shotgun approach. For example, I saw many years ago an application where the person had like 20 things listed under volunteer activities, but when you looked at them it was 1 hour here, 1 hour there. That shows me that you're just trying to sort of get a lot of stuff in there but don't have any specific interests. So again, you're going to work with your advisor to make sure that you're meeting the academic prerequisites that the schools look at. Now, the APTA sort of has a list of suggested questions for when you're thinking about which schools to look at, because that's part of the prerequisite thing. They suggest that you look at things such as geographic location, the cost and financial aid, Private school will cost more than a public school. Class size, and this really varies. For example, I teach in a very small school. It's a DPT program. We take in 36 students a year. There are some programs that will take in twice that many to as many as 70 to 80 a year. You may want a smaller program so that you can get more student interaction with the professor. Other people may not be worried about the class size. The type of degree, and I'm going to talk about that in a few minutes. Most of you probably know that it is a graduate program, but there are both master's and doctorate programs for the type of degree you can get. The length of the program, part of that's going to depend on whether it's a master's or a doctorate program. Some of you may be concerned with clinical internship opportunities. What do I mean by that? Part of your education is going to be out in the clinic. And if you've got, many of you have a real interest in sports medicine, one of the things you may look at is what sort of internships do they set up, or do they have some specific affiliations, so that you may be able to tailor it more to your interest, perhaps in sports medicine. And then there's the other. For example, you may look at the type of learning philosophy in the program. There's the traditional, where we lecture at you, versus some programs have set up what they call a problem-based, where the student is more involved in the learning. We're given a case scenario, and then you have to sort of go out and identify the things that you need to learn or know. It could be that you want a Christian school. For example, the program I teach in is a very small private Christian school, and we emphasize the integration of spirituality with health care. So there are other attributes that you may be looking for when you look at a school, but those are some of the things to think about as you're trying to decide which school to go to, and then you can find out what prerequisites they have. I mentioned the type of physical therapy program. You make sure that it's an accredited program. There are a few that are out there that are not accredited, although we try to keep close control over that. There are 212 accredited programs currently. 95% of those are doctorate of physical therapy programs. This is a clinical doctorate. It's not a PhD. But that's where the trend is going. The vision of the American Physical Therapy Association is that by the year 2020, all programs will be a doctorate. And the transition took place partly to try to get the whole profession towards one of what's called direct access, meaning that if a patient sprains their ankle, they can come directly into a physical therapist and not have to go see a physician first. But there's a lot of responsibility there, because then you need to be able to identify, should you actually be seeing them, or do they need to go back to a physician? And so that's some of the difference in the doctorate versus the master's level programs. The rest are masters. There's no longer any bachelors in the United States. But either one is acceptable for licensure at this point. So you can get a master's and get licensed in practice. The only way it might affect you is some states that have direct access require that you either have a doctorate or that you've taken the courses with the information that would enable you to prove competency in some of the issues on direct access. So you may have to have a little extra coursework or experience if you only have a master's program. What about the prerequisites? That's what most of you are working on right now. It really varies school by school. Most schools require a bachelor's degree with specific courses spread out in there. There are some programs that only require 3 years. Again, my program is a 3+3. We take students after their junior year, but they have to have a fairly specific type of program that blends undergraduate and the upper division credits, and also meeting the specific course type things. The APTA on their website has a little area that you can go to look at what's required. And basically, more than 50% of the schools require things like anatomy, physiology, chemistries. Some will specify you need chemistries with the lab, or you need this type of chemistry. Physics. Usually chemistry and physics, those are so that we know that you've got a good background of understanding, such as the physics of movement, physics that apply to the electrical modalities, some of the chemical changes that take place in the body or the cell during exercise, and then you can translate it to chemical changes that are occurring with other activities. Statistics, psychology, general biology, not to name, but each school will have different ones. There's enough overlap that most of the time, if you're careful, you should be able to hit the prerequisites for many physical therapy schools, as long as you read through their requirements fairly carefully. What's the average PT student that comes in? Well, 74% have a bachelor's degree. Even, in the programs such as ours, which is a 3+3, more than half of our students have a bachelor's degree. The average pre-PT cumulative GPA is 3.44. That was and this is nationwide as of 2007. It's going to vary by program. So usually they'll identify a minimum of 3.0, but I can tell you that it's competitive enough, sort of like medical school, that to be competitive, you'll want to be well above that 3.0. For example, our program last year was someplace around 3.6. Out of an average of 144 applicants, about 35 are actually enrolled in a program. Now, one of the things to realize is out of that 144 applicants, about 40 of them aren't even eligible. Maybe their GPA wasn't even 3.0. The difference between an applicant enrolled and so forth is you're going to get people accepted that are actually accepted to several programs. So you have more people accepted than are actually enrolled in a program. Enrolled means those that are starting. But regardless, you can imagine out of 100 eligible applicants, only 35 actually start the program. Probably a few of those are people that were accepted at multiple places. Again, it's competitive. The average graduation rate, 90%. That's not just always academics that take students out. Realize that sometimes if they get in and decide this is not the field for them, that's when I'm always telling people, make sure you do some observation of different types of settings. And I'll talk a little bit more about that. But 85% pass their licensure on the first try. In fact, and then most of those others pass it on the second try. And 99% have a job at 6 months post-graduation. In fact, right now the PT field, because our baby boomer age is so large, there's a shortage nationwide of PTs. So if you haven't already heard, there's plenty of jobs out there. Many of my students have contracts 6 months before they graduate with sign-on bonuses. So it's a good, field to go to. Important things, applying to PT school. Some of you may be already at that level. One of the first things you need to do is determine the application method used by the school. There is a new centralized application process that was started about a year ago, and more schools are joining up on that. And that process, then you fill out all this stuff online, and it sends it all out to the schools. However, not all schools use that. So one of the things you need to decide is if you're going to a certain school, which process do they use? Do they use one just unique to their school, or do they use the centralized process? Next thing I'd say there on complete the application, and that may sound sort of simple, but I have seen applications come in that, there were blanks in them, that they didn't answer all the questions. One of the things in any type of, even if it's a regular job, that people are looking at is, are you thorough? So make sure you complete the application. You have to get letters of reference from most schools, and I would never assume you've asked somebody to send a letter of reference. Don't assume that they've sent it. Call or check up to make sure that things have been sent and received. You know, the onus of is everything in and done is on you, not on the people that you've asked to write something, even though professionally they ought to do it. But, you know, whether or not you get in, if a reference didn't get there, it was up to you to follow up. Observation hours. Not all schools require observation hours, but I'd honestly tell you, make sure that you get out and do some observation, even if just for yourself, and observe in more than one setting. I can tell you, I remember a student passing out one time during a wound care lecture, and afterwards she said to me she didn't realize that she had to deal with wounds, but that's a part of physical therapy. We do wound care. So I think doing an observation of some different settings so that you know the different things that PT is doing, that will help you to decide truly whether you want a career in this field or not. You have to take the GRE. Most schools require that. And then again, as I've put at the bottom, follow up. Some schools require supplementary information that in their stuff. Make sure that you've taken care of that as well as the main application. So what happens once you've applied? Well, obviously in admissions, the first thing we look at is, have you taken the prerequisite courses and how did you do on them? What's your GPA, both cumulative and science? Did you meet the minimal GRE requirements? Some schools don't have any, but other schools will have some minimal requirements for those GREs. The observation, you know, and many times we do, I've got at the bottom there interviews. One of the first easiest things I want to know is, what do you know about PT? Do you know where the APTA website is? Do you know about some of the different issues that are going on in physical therapy? Do you know that you're going to have to do things like wound care? It's not just all sports medicine. So observation, have you done it and what did you learn from it? Obviously on the admissions we look at the references. What are professionals telling us about what you're like as a person? Are you organized? Are you somebody who follows through on your responsibilities? If you have an interview, come prepared. And being prepared for an interview, put your best foot forward. Think of it like a job. If you show up in shorts and a t-shirt, I'm probably not going to rate you very highly, because that tells me you don't really want it. Now, you don't have to show up in a three-piece suit, but you come dressed professionally. Prepare one or two questions ahead of time. We're going to ask you lots of questions, but if you're really interested in getting in, I'd hope that you would have some insightful questions, things that you think are important to you that maybe you can't find on the website that you want to know about. It may even be something as simple as, can I talk with some of the students in your program or observe a class? You know, what are some of the biggest problems that you see for students? But show that you've thought about it. Now, I do want to say there are other options to PT, and I'm going to come back to those because I didn't come through all this normal admissions and everything else. So I'll come back and talk about that in just a minute. The PT curriculum, it's sort of like med school. Once you're ours, you don't get out of our building much, and I'm sure that most PT programs are pretty much the same. I know down in Texas it was. The basic requirements for PT programs are, we have accreditation standards. And so in an entry-level program, you're not going to be specializing. You specialize after you've got your basic PT degree. Programs range anywhere from 2 to 3 years in length. Part of that, again, depends on if it's master's or doctorate. The majority are running 2.5 to 3 years in length. And it's a combination of the academic and clinical. You're going to see a few different models of how people integrate the clinical in there. We always start by emphasizing science and basic clinical skills early on, and then you start getting into more advanced courses. Some of the schools are located near hospitals, so sometimes what they can do is integrate you into the clinic on a more frequent basis for short periods of time. Others may be further, so you're at the school for longer periods and then you go out for several weeks or longer. Many of them, the longer, what we call internships, are at the end. So our students, for example, they're here a full year, and then they go on a 4-week practicum. Then they come back another year and a half, and then they're out for 16 weeks. They come back in for a short while, and then they're out for another 16 weeks. So they get those long internships at different facilities so they can get different types of experience. And then once you graduate, you sit for licensure. Licensure is a nationalized test, but the standard for passing is set by the states. So there's a minimum that you know will suffice to pass nationally, but certain states may not allow you to practice if you don't get a higher level than the minimum. So let's talk about careers in PT practice settings. And I've listed the most common, but you know, if you're a creative person, you can make your own niche. Acute care. Acute care is such as the picture here, working in a hospital setting, and it can be, and even in the hospitals, many times nowadays they split it up into things such as orthopedics, cardiac care, stroke, things of that nature. And you get a good diversity there. It's a wide thing. It's usually a very fast pace, and some people really enjoy it. Pediatrics. Pediatrics can be in several different types of settings, all the way from working with the school system, where you'd be going from school to school and working with kids that have been mainstreamed, working with home health, with children that were born with disabilities or other types of congenital problems that need physical therapy, but maybe they're too sick to get out of the house, or pediatric settings associated with clinics where they're bringing in children for you to see. Rehabilitation. Rehabilitation settings sometimes are associated with a hospital, but they're beyond the acute care individuals that are going to need more follow-up. Or sometimes these are long-term type facilities, such as for somebody who's had a traumatic head injury and is never going to be able to be discharged to go home. And so they can be challenging. The nice thing about rehab settings is you usually get more time to work with the patient. Skilled nursing facilities, they, you know, sometimes you may be thinking, oh, I don't want to work with a bunch of old people, but it can be quite fun. It's challenging. Many times you're given the opportunity, you can set up classes as well as doing individual physical therapy stuff, and you may have charge over different types of settings. And home health is growing rapidly in the United States. They've discovered that that's especially in certain areas, it's a very effective, cost-effective way to see patients. And again, the types of patients you'll see with home health is quite diverse, and it involves you traveling around, though. Outpatient settings, you can see almost any kind of patient possible in an outpatient setting. Some outpatient settings will specialize just in orthopedics, where others will have a broad diversity of orthopedics and neuro. Outpatient settings is often the kind you might be thinking of, where you would work with a sports team or organization. Some of the orthopedic clinics will actually, the physical therapy will see people in the clinic, and then different ones will be responsible for helping to cover teams throughout the year, doing either rehab for people that have been injured, or maybe even helping to identify some preventive type things that can be done with those teams. And then private practice, private practice tends to be most of the outpatient settings, but some of the private practice people will just set up their own. That's where I said you could carve out a niche. They set up something that if they're in a sports interest, they may be able to do consulting or find unique opportunities. I had a colleague who worked with the PGA one year and went from, and basically they paid for him. He followed the tour around, worked with all the different golfers throughout the year to help them with different injuries that were incurred during that time, and really enjoyed it, had to be willing to travel. Once you're practicing, you can specialize. There are many ways to specialize. The American Board of Physical Therapy Specialties is run through the APTA, and on your screen are the specialties that have so far been identified through APTA. All of these specialties involve having a certain number of hours of practice within that setting. So for cardiovascular, working with cardiac pulmonary patients, either in acute care or outpatient, but you have to have a certain number of hours of practice. They require continuing education along this vein, and then a continuing competence type of test. Usually there's a written test. There may also be a practical test with it. And then the specialty is held for so many years, and then you would have to recertify to show that you're keeping up with the changes in the field and still practicing in that area. The most common ones, the ones that are that you've got the most specialists in right now, are the orthopedics and neurology, and I think sports is a close third. But that's not to say that the other ones don't have quite a few specialists in them. These are a way that you can also advance within the field. If you've got a specialty, you can teach in a clinical setting. For example, in my university, we bring in people who have orthopedics certification to teach certain orthopedics classes, so that we know that our students are getting somebody who is out there in the field, who's working with the patients, but is truly specialized and advanced in the field. And most universities will do it that way, that certain classes are going to be taught by specialists this way. There are other types of ways of advancing your career. Many of them are certification programs. Usually these are by specialty. For example, in orthopedics or manual therapy, the North American Institute of Orthopedic and Manual Therapy has an entire set of courses and exams so you could become certified as a manual therapist. The Maitland has a series of classes that you can get certified in. Mackenzie is another approach to low back and exercise. There are neurological ones such as neurodevelopmental treatment certification. Again, a series of classes followed by tests and practice within the field. There are certifications for lymphedema, which is a special vascular problem that PTs will work with. You can also consider advanced education, and probably right now most of you are thinking you don't want more advanced education, but there are post-professional degrees. In physical therapy, there's Doctor of Science of Physical Therapy or things of this nature. Often they have an emphasis towards one specialization. For example, we have a post-professional program at our school that the student takes certain advanced classes, plus they take the North American Institute of Manual Therapy program, and they're then specialized in orthopedics and manual therapy. They've got a certification. They're eligible to sit for the APTA specialization. Plus, with that advanced degree, they can teach in a physical therapy program. PhD. I'm a PhD, and as you heard from that, if you listened closely to the dates, I'm a backwards PhD. I did my exercise phys degree, was asked to start teaching in a PT program the sciences, so I start teaching anatomy and neuroanatomy and exercise phys. And at the end of the first year, they asked me if I was interested in becoming a PT, and so I was a full-time faculty member. Started taking one class a semester, and then when we moved up to where I am now, I was half-time faculty, half-time student, and then I stepped right into a teaching position, and I just practiced part-time. PhDs are basically only necessary if you're truly going to go into teaching or into research. Doctor of Health Science is another way. Many of these types of programs use a mixture of on-site and then distance ed, especially if you've already got the PT thing. Then what they'll have you do is you come in for like a week and then you do distance ed. And that allows you to practice in the field, pay back all your student loans, while still advancing your degree in education. Now I've put some resources up here. One of the biggest resources you should know is the American Physical Therapy Association. On their website they have a link to the schools, so if you're trying to find out about different schools, you can go in there and it will actually link you right up to that school's webpage. There's general information regarding physical therapy, current issues, things to think about. Talks about education programs and other student resources. And then the other resource that I put there is the centralized application process. So once you've looked at the school and find out which application process you look, then you know, if it's a centralized one, this is where you would go to sign up for your to start the whole process moving along. And with that, I'll leave you with a gorgeous picture from Michigan and open the line up to questions and see if we can find out what you guys need to know.
Great. Dr. Miller, thank you very much for the presentation. Just as a reminder for questions, there are two ways to ask questions. The first way is you can raise your hand using the little hand icon on the left side of your toolbar. If you do that, I will unmute either your phone line or through the speaker on your computer so that you can ask that yourself, or you can just type the question in the toolbar and I will read the question to the group. So the first question that we have is from Brian, and he wants to know, if your GPA is not as strong, does activity in extracurricular and volunteer areas help show competency and aid in the admission process?
Yes, it depends on the school. I have to qualify that, and that there are some times when some schools the GPA is it, and if you don't have something over their minimum. Now, I can tell you, if you're not over the minimum, most of them won't even look at you. But let's say you're only at a 3.2. Then, yes, that's where you have to sell yourself. You need those other activities in there. Don't do so many other activities that the GPA gets worse. But that's where, look at also those schools and ask them. Because some schools may say, yes, they're going to help you, and other schools will say, sorry, if you're not at a certain level, you probably won't make it. The other thing is to say, can you repeat one or two classes to pull that GPA up?
Okay. Now we have a question from Charlotte, and I'm going to unmute the phone line. Charlotte, are you there?
Yes, I am. Good afternoon. We're from Texas Women's University, and I have a student that has a question for you.
Oh, okay.
So there's a school that I've applied to that is not accredited yet. It's a very new program. How do I find out or know if they're going to be accredited by the time we graduate?
If I heard you, because it's sort of moot there, you've got a school down there that's not accredited yet, and you want to find out if they're going to be accredited by the time you graduate.
Yes.
Okay. First of all, the first way to find out if they're accredited or in the process is to check with the APTA. The only problem I'd say is there's no way to know if they're going to be accredited. In that you can find out, if things are on track there, have they got the faculty? Every school does have to go through the startup process in that they won't accredit you until you've graduated your first class, if I remember correctly. I could be off a little bit, but I know that they don't accredit you before you've had students. So honestly, there's one of two. One of the things they have to do for accreditation, though, is they give a backup plan. So they have to say, if this program doesn't make it, what's going to happen to our students? And so that's probably a question I would ask them. If they're not accredited yet, I'd find out what is their plan for if they don't get accredited, so that you don't put all your money into education and then find out that you're not eligible to sit for licensure. So that's the best thing that I do is talk to them, find out what their plan is, because there's no way to find out if they're going to be accredited. They can't be accredited, as I said, until somebody's graduated, I don't think. APTA website would be the best place to check.
So my understanding is that if they do go to an uncredited PT, there is still an opportunity, though, for them to sit for the licensure if there's been a plan.
Well, what the plan is usually that means some other school has to take those students in. And so that's why I'd say I would check with the APTA what the plan is. I know we used to have an affiliated program, and when we went to get them accredited, in that document we had to say that those students, if that school shut down, they would be able to come up to our main program and would be integrated into this program so that they graduated with a degree from our school.
Thank you. We have a second question, if we may.
Uh-huh.
Michelle?
I want to make sure I heard you right. Did you mention something about a national licensure?
I couldn't hear. I'm sorry.
So the point is that when you're sitting for your licensure, it is a national licensure, correct?
It's a national licensure test in that you would go. You go to things like the Sylvan Learning Center or something like that, which it's electronic. It's through a nationalized system. And so then you're eligible. You sit it in each state. Each state can set their passing level, though. So let's say that the minimum passing level is 600, but Michigan, and we'll pretend because I don't know it, Michigan may say, well, to be licensed in Michigan, you need a 615. So I've passed licensure, and I may get a license in some states, but not in every state. But yes, once I'm licensed, once I've passed it, then there's reciprocity between different states. So then I can move from state to state, and they just transfer that license because it's a national test. Does that make sense?
Yeah, that's lovely, because some licensures you have to resit in that state to take it. So
yeah,
you're saying it's based upon what initial score you had might allow you to be open to practice in different states.
Yes, it does allow you to practice. The only thing that you may have to do is some states have separate little components that perhaps address the law in their states. And so sometimes there's reciprocity for the primary thing, but you may have to take a small thing to sit for their state laws. Okay.
I have a question from an academic advisor that deals with a lot of our students. Her name is Janelle Davis.
Hi, my question is about scholarship opportunities at graduate school level. What kind of things can our students do to obtain that? Are there graduate assistantships? Are there special scholarships? That kind of thing.
What they need to do is check with each school. Graduate school scholarships in general tend to be more limited. So I'd ask, are there specific scholarships at that school? Are there graduate assistantships at that school? Of any nature. The other thing that they might check to see is are there some things based on their that come through their church or through their alumni association or other organizations that may have scholarships. The other thing is some hospitals or clinics will actually offer scholarships as well.
Okay, we are going to switch over and take a question from Jeffrey now. He wants to know how much it matters the school that you get your degree from. When you're applying, how much does the school that you have your initial coursework in matter towards the admissions process?
It really doesn't matter much at all. I mean, I've seen students from all sorts of schools. I don't care where their degree is from. I look at their GPA, I look at the activities and so forth. But the only way it might affect their looking at their school is if you've gone to a really challenging school, you've gone to a Harvard or Yale or something like that. I might know that your GPA might be just a little lower because you're at a very academically challenging school versus if you went to one of the local colleges. But a lot of schools, that's not the primary thing. We're looking at what your potential is. So your undergrad school isn't that important. In fact, getting a PT degree, once you've got your PT licensure, you know, looking for a job, people don't ask you necessarily what school you went to for your PT licensure. In a few spots they may, but they're looking for a warm body that can treat patients half the time. So it's even of minimal interest there. Does that help?
Mm-hmm. Yeah. The next question is, would you be able to describe a typical day for a PT who works in a clinical setting?
Oh, okay. And I'll hit a few different types of clinical setting. For example, I worked for quite a while in acute care. Typical day there at the hospital started at 8 o'clock, so usually I had to get in there a few minutes before 8. In acute care, what happens is all the orders come into PT, so I'd go in and I'd check what the orders are, and what they do is different hospitals are organized different ways, but they sort of identify who's going to take which patients, which ones are brand new patients that we just got order for them. So you might have 3 new patients that you know, they just had surgery this morning or they had surgery yesterday afternoon, and then you might have maybe 3 or 4 other ones that these are ones you saw yesterday and you need to go back and see them again. So in an acute care is sort of one of those time crunch things, but you have to be flexible at the same time. So you run up, you decide who your first patient is, and you may decide who your first patient is based on when are they getting their pain meds or which floor tends to have the patients out of breakfast earliest, or you know that they're going to have another procedure. So you go up and you see that patient. Generally in acute care you only get half an hour with them. And half an hour, you know, if it's an evaluation, that means you're taking 5 to 10 minutes to look through their chart to make sure there's no contraindications to you going in to see them, or has there been a change in their status since the stuff went through. Then you go in and you see the patient. And as I sort of said, you had to be flexible. Well, flexible means you may go in to see the patient, and unfortunately they're vomiting at the time, or they're in the bathroom at the time. So then it may be that you say, all right, I'll be back in half an hour. I'm going to go see my next patient. But anyway, you go, you see them, you do whatever needs to be done with that patient. Usually I found I was running from patient to patient. So, and as I said, every half hour during the morning, then by noon you get a break for lunch. May do some paperwork during that time. And then you're off to see patients again. Usually patients in the hospital, you're seeing them, some patients you're seeing twice a day, others you're seeing once a day. Depends on what they're there for. But usually twice a day because you're trying to really speed up the process so that they'll be independent and able to go home. At least you hope so. If it's an outpatient, and you go to 5, an outpatient setting is going to be a little bit more variable. Some of the settings, they allow you to plan like 3 10-hour days, and then you'd have the other day off. Or you may alter your schedule around, because many outpatient clinics, they'll go from 7 in the morning till 7 at night to allow for some hours there for people that are working and can't get in during the work day. There usually you'll have 1 or 2 assistants there that once you do an evaluation of a patient, then you can start. So you may come in and maybe you've got the first half hour just for paperwork or to catch up. There is a lot of paperwork in healthcare. And then you may have an hour with a patient who's new that you're going to do an initial assessment on, and then start them out on some exercise and some treatment depending on what they need. Then your next patient could be somebody that you see for 15 minutes, and because they've come back and you've already set them up, and then you sort of reassess them, and then maybe your assistant takes over supervising their exercise. So it's still a pretty full day. But again, it can be varied. It could be that maybe I'm working half a day and then I come back at 4 o'clock to go cover the high school sports. depending on sort of the outpatient setting. So those are the ones that I've worked the most. I've worked a nursing home too, and that's a sort of different in there. Then I would go in there at 9 o'clock because I used to like to try to give them a little extra time to get waking. And you go from, you see which patients need to be seen. You're not going to be seeing all of them. And sort of a flexible schedule there. Usually I worked there just half a day. I'd go in and do some assessments. And then I was back out to my other job. So what other sorts of things would help?
The next question is from Devin, and the question is, how important is it that all prerequisites are completed at a four-year university versus a junior college?
I don't think, at least at our school, I don't think that's important. All they care about is have you completed the prerequisites. Although sometimes one of the things that we do look, and it depends on the school. So one, you complete the prerequisites. Whether it's at the same school isn't necessarily that important. Although it would be, to me, a red flag if I see that it's taken you 8 years to finish a degree because you took one class here and then one class there and you went to 3 different schools. And that sounds, or 4 different schools, and that sounds strange, but we've seen things like that occasionally. And then you wonder why people are constantly switching schools or why they're only taking one class at a time. And so usually then we try to find out, is it because they can't handle more than one class at a time, or is it because they're like the rest of us, they're working their way through school and they couldn't afford to take more. So they'll ask questions. But having enough, more than one school on the transcript isn't necessarily terrible, because I think a lot of us have to do, maybe a class at a different place. It may be that your school doesn't offer one of those prereqs, so that's not a problem.
Can you discuss things that a non-traditional student might need to consider when applying to PT school? For example, someone who has a bachelor's degree from several years ago and is looking to make a career change.
We get a lot of those. And I think the biggest thing, and actually for any of you, but especially if you've been out of school for a while, is to recognize the fact that it's like it's medical school. I mean, our first-year students right now are probably in class about 6 hours a day, and then they're studying the rest of the day and evening. It may be a little bit less with our second-year students right now, but I'm looking at their schedule, and we give them out a weekly schedule, and they go from 8:30 to 4:30 on Monday, from 8:30 to 6:30 on Tuesday, and so part of it is just getting back into realizing that you're all of a sudden, all the extra stuff that you got to do is going to go out by the wayside. Probably the other thing I'd say is I do know that people that have been out longer, some of our older students, the first part of the year, there's a lot of memorization. Like we have anatomy, and anatomy is a lot of credits, and you do dissection, and you have to know all the muscles, bones, nerves, and everything inside and out. So there's a lot of memorization, and returning students sometimes have problems with that. Whereas later on, they might be better at putting things together, integrating information from physiology and anatomy along with the neurotreatment concepts. So that's the pros and cons. The bigger thing, I think, is, again, always the fact that all of a sudden, once you're back in PT school, it's very stressful. We take off your light, and probably learning some different study routines and trying to realize that for a little while there, you're going to have to get rid of some of the stuff that you've been able to do probably for a few years because your time is going to become much more focused. Does that make sense?
Yeah, definitely. The next question we have is, could you please explain the clinical electrophysiology specialization?
The clinical
electrophysiology.
Yeah, the clinical electrophysiology component is a specialty of people that are doing treatments with certain electrical modalities and that do things such as electrical nerve conduction studies. So it involves a wide variety. It involves, first of all, that knowledge of the different modalities that are electrically oriented, and we do quite a few of those. But it also involves things for testing for individuals that may have problems, either a damage to their nerve, the peripheral nerve, or that may have some other type of disease process that's affecting the nerves, and knowing how to do the nerve testing and interpret it, and then design programs to try to address the damage or the problems that have been done. So that's the clinical electrophysiology specialty.
Okay, the next question is from Chris. Is one particular undergrad major better than others?
I don't think so. One of the things that the accreditation requirements talk about is that we're supposed to be taking in well-rounded students. So, you know, I personally think exercise phys and kinesiology, they're wonderful undergrad things because you have such a close understanding of exercise, and one of the primary things we do as physical therapists is exercise. And I think that that understanding from the undergraduate on really definitely gives you a good boost. But as far as getting into PT school, no, you have to have those prerequisites. But one degree versus another won't be ranked higher than the other. So I do think it'll help you personally. Anything in the exercise science will. But that's my personal bias, I admit it.
Okay, and the next question is one that we get for every webinar. What is the average entry-level salary?
Yeah. Well, I heard, you know, from this last year's group that was starting, the lowest I think was $60,000. The highest starting salary I had for student this last year was $80,000 that I remember. So it's a pretty good starting salary. And some of them also had things that are called sign-on bonuses. So they may have gotten an extra $5,000 for signing with that company.
Okay, and we have one last question from Brian, and he would like to know, is an internship necessary if ample volunteer hours have been completed prior to the application process?
Now, the internship is what you're doing after you've got your PT class. Meaning that's what we send you out for your, so I think misunderstanding. Is observation necessary? Because internship, and the stuff that I presented, the internship is what you are doing for physical therapy school. It's part of the physical therapy coursework, in that once you've had like your orthopedics classes, you go out and you're working in an orthopedic clinic as a student physical therapist. So you might want to, I'm not quite sure if you understood so that's the type of internship I'm talking about.
Okay. Okay, and then I guess one final question that just came in here. Can you apply prior to completing all the prerequisites?
Oh, yes. Yeah. Most of the time people are still finishing their coursework, and so they may be in their final 3 courses when they're actually doing the application process. So some schools, what you'll get is you'll get, you know, if you're accepted or you interview, it may be, and if you actually get accepted, it may be that the letter says to you, you're accepted conditional on successful completion of those courses and, you know, other things like your GPA not dropping or things of that nature. So yes, many schools you can apply while you're still completing that stuff, but it has to be completed by the time you start PT school.
Great. Well, those are all the questions that we have had submitted. So I just like to once again thank Dr. Miller for her willingness to share a lot of really good information. And just as a reminder, ACSM is offering several of these Career Spotlight webinars every month. So just visit the ACSM website at www.acsm.org for a list of future offerings. We update that every few weeks. With that, we are concluding today's event. Thank you very much for your participation, and have a wonderful afternoon. Thank you.
All right.
Thank you very much.
Oh, I was sitting here thinking, I know she said